stands at 535 people. This is because out of the 1,077 samples tested, some 45 people have turned positive. This, of course, is the highest number recorded in 24 hours ever since the first case on the 12th of March. Out of this number, 29 are from Nairobi, 11 are from Mombasa, while 5 are from Wajir, and 1 is a foreign national from Somali. The 5 from Wajir have a history of recent travel to Mogadishu. In terms of gender, we have 30 males and 15 females. Also, on a positive note, I also want to add that today we have recorded 9 new discharges. This brings the total number of those who have recovered, turned from positive to negative, to 182. But more importantly, today, I also want to point out the cumulative distribution of in some 3 key areas. The first one is Isli. The 29 cases that you have heard which are from Nairobi are all from Isli. That means that as we speak, there are 63 cases within the Isli area alone. That tells you then that there is community spread happening within Nairobi, specifically in the area of Isli. This comes out of the result of mass testing in that area within the last 24 hours. Kawangware continues also to be an area of concern, and there are 24 in that area. And then in Mombasa, as the trend, you have been hearing the trend in Mombasa, in Old Town, in Mombasa Old Town alone, we now have 39 cases. Fellow Kenyans, this tells us that in those areas, in the area of Kawangware, in the area of Isli, in the area of Old Town Mombasa, that we need to take action in those particular areas. And we are in the process today of consultation with the respective authorities in those counties so that we can determine what action we are going to take. As we reported in our daily briefs, we continue to observe behavior and practices which stigmatize persons who have either contacted or recovered from the disease. Let me say this. There is not a single person who is immune to the virus. Not one person. You are as likely to have it as I am. And therefore, nobody should be stigmatized because of the fact that they actually contacted the disease, or they were suspected. And in fact, ladies and gentlemen, I can tell you of a case where a lady who is a member of a choir, or a church choir to boot, wanted to sing with the choir, and because she was positive and had turned negative, people in the choir were suspicious about whether she should be in the choir or not. Now, I think we should be a bit more generous than that, and I think that that idea that somebody is a bad person or somebody is going to pass it to you is not a good thing, and we should not look at it that way. And if you remember, it used to be the... So because anybody... I think what we should have is a lot of understanding. What we should have is a lot of empathy and sympathy so that we do not discriminate. Let me remind you, and I quote, And this is the case we are seeing today, that whoever heeds discipline shows the way to life. But whoever ignores correction leads, is in the Bible, Proverbs 10:17. The reason I am quoting this verse, fellow Kenyans, is because the figures that we are hearing today are a clear demonstration that things are not getting better. And people who are telling others that things are better are lying to them. And somehow, somewhere along the line, we seem to have come to the conclusion as a society that things have gone back to normal. Today's figures show things are far, far from normal. Things are very challenging. And those who are exhibiting the indiscipline that I've referred to, leading others astray, are becoming a common phenomenon. You will remember that 2 weeks ago or so, His Excellency the President de-escalated measures to do with hotels and eateries. You have all seen for yourselves, the media, even people in the media have been calling me and telling me you can see the abuse that people are exhibiting in the eateries and in the hotels. We gave certain protocols, and clearly a lot of people are not following those protocols. Yet there are those who are assisting us. There are those who are observing these measures. There are young men and young women walking back into those places who would otherwise be at home and whose livelihood is being threatened not by the government, but by those who misbehave and then cause action to be taken across the board and across everybody else. And for today, I am still saying that there is a chance, and I ask those responsible to please adhere to the rules. But there is only so far that we can go and so many pleases that we can make. So those of you who continue on this path of exploiting Kenyans, on this path of exposing Kenyans, you will bear the brunt of the law. And I want to add here that we will take action. You will face the law. So I am asking and appealing to you to make it unnecessary for our security forces to be so involved in observing hotels that then they are taken away from matters of much more importance. So I want to appeal to those who are not doing the social distancing, who are not doing the hand washing, who are not observing the basic hygiene that we have put in place, that it is as a result of such misbehavior that we are now upwards at 45. And we have been warned by those modeling for us within the Ministry of Health that unless we change, we will continue to see upwards of 50 people per day, and of course this will be correspondingly reflected in other areas of our lives. The fact of the matter is, where we are right now, you are either with Kenyans or you are against us. When you are against us is when you expose other Kenyans. You cannot be behaving totally normally and then looking at every other Kenyan trying so hard and expect that you are going to be applauded for your action. You cannot be in the middle and responsive to the call of time. Our destiny as a people is bound now in both collective and individual response to the pandemic. Previously, I have said that we will either rise together or fall together on this one. If you have been relatives and friends to abuse the containment measures that have been put in place, we weaken our collective chances against flattening the curve. By doing so, we make mockery of our 2 months' worth of effort to prevent this virus from outrunning our healthcare system. Ultimately, we are inviting death upon our loved ones and upon ourselves. But all is not lost. We are stronger and smarter than this. I believe it. We can stop this tide through our collective strong will, discipline, determination, and timely moves. Listen, we can do better. But when I say we, I am not referring to the government. I am referring to you and I. I am referring to your brother and your sister. I am referring to my mother. I am referring to my wife. I am referring to my children. These are the people who we are saying can do better. So whenever we say we can do better, please appreciate it's got nothing to do with the government. This got something to do with yourself. And as I've repeatedly said, if you assume that the person sitting next to you or the person standing next to you is possibly positive, then you will take action to stand further from them. I share the feelings that people have. I have been sent by people in anger who send me messages in anger, having observed people behaving in social partying, people sitting outside bars and drinking away, people sitting together, even during this time of Ramadan, against advice by religious leaders, going out and you can see everybody crowding in together. This is not good for you, and it is not good for that person you are eating with. And it is not comfortable. It is not comfortable for leaders who have to keep on talking about this issue. And I appeal again and again to our political class to kindly focus seriously on educating our people and telling our people the ills and the challenges that as a nation we face. But this is not nice. Nobody is living as they used to. We are all challenged. Things have not been easy. Things are getting difficult. And we all have to stay together and help each other. In fact, nothing is as it used to be. I cannot promise you that we are going to change this in the very near future. It doesn't look that way anywhere on earth. But I can tell you that they will eventually get better. What I know is that if together we stay focused, we shall surely overcome and get our lives back. As I conclude, I want to take this opportunity to inform you that today we are celebrating the International Day for Midwife, whose theme is Midwives with Women, Celebrate, Demonstrate, Mobilize, Unite. The day is usually celebrated on the 5th of May worldwide. But today, we are celebrating in the midst of this pandemic. And midwives are the primary care. I thank you. Ningetaka kuongeza kidogo, niseme ya kwamba leo hii ndio tumepata watu wale wengi zaidi ambao wamepata hii virusi kuliko siku nyingine yoyote tangu mtu wa kwanza aliyepata hii virusi tarehe 12 mwezi wa Machi. Ningetaka kusema kuna pahali imefika ambapo tunaona kama tunaona vile watu wanaendelea kama tutafika pale tunafikiria ati sasa maisha imerudi kwa kawaida. Ningetaka kusema ya kwamba maisha haijarudi kwa kawaida. Maisha ile tunaishi sio ile ya kawaida. Tunaishi wakati ambapo virusi inaendelea katika nchi yetu, katika town zetu. Sana leo hii nimesema kama area ya Isili jana peke yake ilipata watu 29 kwa siku moja. Na ndio tunasema ni lazima tuanze kufikiria tena kama vile tunasema vile tunafanya. Watu wanafuata zile sheria tumetoa, watu wanafuata au hawafuati. Nimesema katika kule Old Town Mombasa watu wanaendelea kupata hii virusi na wengine wanawaambia wapimwe wanakataa. Lakini nafurahia ya kwamba kazi ya Governor Joho kule Old Town Mombasa imeonyesha ya kwamba watu wakisungu naelewa na wameanza kujitokeza ndio wapimwe hii virusi. Kwa hivyo mimi nikusihi na mama na wazee tujue ya kwamba sisi bado tuko hatarini. Ni lazima tujikabu hii ugonjwa jameni imeanza kuzorota. Na ukiangalia nchi zetu, ukiangalia nchi za jirani, mambo inaelekea na vile kunafanyika. Ni lazima sisi wa Kenya tuanze kuchukua hatua ndio tusije tukawa na ugonjwa utupite na ipite kiasi ile sisi kama Wizara ya Afya tunaweza pigana nayo. Kwa hivyo ni kusema tu vile, tafadhali watu wasije wakaanza kurudi kazini. Wale watu ambao waliambiwa tufanye kazi kutoka nyumbani, tuendelee kufanya kazi kutoka nyumbani. Wale watu ambao walikuwa hawatoki town, umeona siku hizi traffic jam imekuwa mingi. Ni kusema watu wamerudi maofisi kama kawaida. Tukifanya hivi jameni, tutakuja kuumia. Kwa hivyo mimi ni tufikirie tena, na hivi karibuni, wiki hii kabla haijaenda, itatoa amri zingine ndio tuone kwamba tumekwamisha hii virusi. Asanteni sana. I'll take 3 questions only.
Kuzipima. Je, mnapanga kuchukua hatua gani kizingatiwa kwamba wanahatarisha maisha ya Wakenya? Na swali la pili ni kuhusu, tumepokea taarifa kutoka upande wa Malaba pale katika mpaka. Wahudumu wa malori wanasema ya kwamba wanalazimishwa kupimwa virusi vya corona kutoka upande wa Uganda, ilhali wanahofia kwamba wakipimwa kutoka upande huo basi watazuiliwa kule Uganda, na wangependa wao wanapimwa kutoka humu nchini.
Let me just reply to those ones first. First and foremost, tangu juzi tulikuwa tukisema na tukaambiwa madereva wetu kabla hujatoka Mombasa upimwe na upatiwe certificate ya kwenda, ndio ukifika pale Uganda, pale Malamba ama Busia, unapita mara moja. Na nilisema ya kwamba hivyo ndio tumesikizana na serikali ya Uganda, serikali ya Rwanda na serikali ya Kenya zimesikizana. Ukiwa unaenda Uganda, unachukua mizigo kutoka Mombasa, basi ni lazima upimwe kutoka Mombasa ndio uweze kwenda mara moja mpaka Uganda. Ukienda bila kupimwa, ukifika pale katika border, utakaa hapo mpaka upimwe upande wa Uganda. And that is something we have explained. We have told our drivers, our truck drivers, that from your destination, that you should be, from your destination, you should take a test at your destination, where you are departing from. Sorry, not destination. Where you are departing from is where you should take your test. So that moving forward, then you not have challenges on the border points. As far as the frontline workers are concerned, we continue to be very pleased about the fact that we are not increasing any more frontline infections. But I'm going to ask Dr. Amos to reply to that. Any more, Dr. Amos? I'll reply to that first.
Okay.
Goja.
Which one?
The one about any other medical workers.
No, the medical workers, thank you, Waziri. I think so far, as we ramped up production of personal protective equipment, we have continued security of our frontline healthcare workers. And in fact, in the past 10 to 14 days, we have not had any infection from a frontline healthcare worker, especially in the public health facilities. I know we have had a challenge with healthcare workers in the private sector for a particular hospital in the Coast Province, and we have had discussions with the county health management to be able to especially address the issues of PPEs and also infection prevention control measures that they need to undertake to ensure that the frontline healthcare workers are protected so that they can be able to offer services to those who may need support from them, especially if they have COVID-19. Thank you.
Let me also add this. Let me also add that we are aware that there has been complaints from health workers in regards to unions, in regards to some of the measures that we want to take, and also in regards to what we have promised them. And I want to say that we will deliver anything that we have promised to the health workers. Sometimes these things take a bit of time. We have to agree with the with the Public Service Commission, with the Salaries and Remuneration Commission. These are some of the areas, some of the delays that come. Is because it's a collective, it's something collective. But what I would like to urge and appeal to our health workers is that please, this is really a time to come together. This is a time for everybody to make some certain sacrifices. We are not even asking you to make a sacrifice in terms of what is due to you, but we ask you to continue making sacrifices as far as being there is concerned, as far as treating as you have continued to do, not just through this pandemic, but through other very challenging situations. And we are grateful, and we appeal to you. There is nothing that cannot be agreed upon. Let us just keep working.
Here with us and is spreading into the communities. Ever since you released the statement that the government is allowing some entities to reopen within major cities, we started seeing a huge number of people coming back into the CBDs. Last night we witnessed a situation in which people were being stuck past curfew hours. If this continues to happen, how will the government deal with the issue, first of all, of breaking of curfew and ensuring that the disease has been contained now that we are 45 plus in terms of the numbers that are being recorded in a day?
Thank you. Let me say this. Let me just say that we have said in the past that we will escalate or de-escalate measures in accordance with the behavior that we observe. This is no exception. I just said earlier that this intervention was supposed to secure some form of livelihood for some people, even as we observe the measures that that we have taken. And it is true that it has been abused. It is a fact of life that people have been going to pubs or to eateries. They order one sausage with 2 beers. They eat that one sausage. Anakula hiyo sausage moja na bia mbili. Anatoka hapo, anaingia hoteli ingine. Huko anakula bia mbili ingine na sausage ingine moja. Anaingia ingine, anauliza chungwa. Hadi sasa ni dessert. Na ingine mbili. Now, my friends, kusema kweli sasa hiyo ni, what are you doing? Sasa hiyo ni kitu gani unafanya jameni? So, I agree with you. We have got a challenge. And it is good for us to accept that there is that challenge. When we start taking steps, for surely we must take steps. When we start taking steps, let not the same individuals start complaining that, you are going backwards and forwards. That's the challenge that will come. The Ministry of Health doesn't seem to know what it is doing because it makes 2 steps forwards and then 1 step back. If that is the case, so be it. What we cannot allow is a situation where we begin to threaten our people just because of some few people who honestly cannot behave. It's amazing. It's a wonder, how some people behave in those circumstances. As for curfew hours, you are very right. We begin to observe people believing for some odd reason, without any sort of announcement. People just start to believe that 7:30 is okay. And you can actually see people jogging at 7:30, 8 o'clock. And this is curfew hours. And then, when they are picked up, you guys in the media are the ones who start making a lot of noise about the fact that people are abusing. And when we go to those hotels and lock up the hotels and close them, because we will do that, then you are the same guys who will start complaining. So I'm glad that for once, the media is telling us and reporting those eateries that are faulting the measures that we have taken. Thank you.
One final question.
Yes, one final question, yes.
You've mentioned about Eastleigh having 29 cases today. How far is the contact tracing so far of the 29, the chain of the 29 people in Eastleigh particularly? And the second question on mass testing, very many people are fearing to go for mass testing, probably because of quarantine fees. Are you going to allow asymptomatic people who test positive to self-quarantine and recover at home? And finally, on restaurants, do you regret reopening restaurants? Because many will say that you are literally feeding and fattening the virus for spread. Do you regret that, and will you reverse that directive? Thank you.
Okay, first and foremost, I do not regret. Let me start from there. I do not regret, because the idea, it came from a good place, and it is not a Mutahi Kagwe decision. It's an effort by the government. This was even announced by the president himself. It was an effort to try and roll back so that people don't go hungry. Part of the president's efforts is to try and see that Kenyans do not go hungry. These are people who are used to working in a hotel, working in a butchery, working in an income-earning facility that do not need government help. They don't need government help usually. So the idea is, why do we are trying so hard not to transport people who usually don't need help to become people who need welfare. It's a whole purpose of reopening these places and some of the work that you see ongoing. But it's just unfortunate. It's just unfortunate that that is the case. As for whether we will roll back and close them all over again, is a measure that is on the table. There is nothing that is not on the table. But we are trying as much as we can to ensure that that is not what we do, if we can get people behaving. So enforcement is also going to be part of the measures that we are going to take. And if somebody is misbehaving, there is nothing to stop us from deregistering that eatery permanently or for the next 6 months. There is nothing to stop us from doing that. It's within the law. Because all we need to do is that the measures that have been taken in the midst of a pandemic in accordance with the Public Health Act to prevent those people and to prevent further infections from happening, then we will be closed for as long as there is this pandemic. Add something.
Thank you. Just to add to what Cabinet Secretary has said regarding Leto's question is that let me start by thanking the people of Visibly for turning out in large numbers voluntarily for this targeted testing in the past 2-3 days. That is why we have seen a surge in our cases. And I want also to thank the business community who have worked very closely with our technical team who are collecting the samples together with the community health volunteers and the local administration. But contact tracing, as soon as we get the results, which are usually relayed early in the morning because the tests are run at night, then the moment we get the results, as we relay the negative results to those who test negative and the positive results to those who test positive, so that the rapid response teams can be able to pick them and take them to the isolation facility, contact tracing begins at that particular moment. And you also asked about the question of self-quarantine at home. Yes, we have looked at this. We have developed some guidelines which we are refining. But based on our experience from self-quarantine mechanisms that we have put into place before we locked our airspace, this is something that requires us to look at it very, very critically because of the risk. We must do what we call a social mapping to see where you are coming from, what kind of house do you live in, how many people live with you, and is it feasible scientifically to be able to maintain a social distance. If that is not possible, then the best course of action, of course, would be to take you to a quarantine facility designated by the government, lest you put your loved ones and the rest of the community in grave danger. Thank you.
Let me also add once more regarding the same, because there has been those people saying or proposing that why are you targeting only certain areas? Areas are targeted in accordance with the occurrence of the cases. Before we go to a place, we are going there because we know there has been cases in that area. And if you look at, and that's why you find these numbers being picked up. And we should be happy that our teams have actually picked all those people. And again, in fact, yesterday, the 29 that came out in Isli, we should be very grateful to them and we should thank them. The 29 people who came yesterday, and indeed we should thank the 260 or 90 or so who are active cases in our hospitals. We should be grateful and thankful to them. Because had they been in the streets, then it tells you that the growth of those people with positive, who are positive, would be much, much higher than it is. Let's thank them, let's keep them in our prayers, and let us not fear testing. But simultaneously, I repeat, let's not also stigmatize anybody for the fact that they have tested. As a matter of fact, we should test as many people as possible, and that is what we are doing. In areas, particularly emphasizing in areas that we feel that there might be people in those areas. But moving on, we are going on to even the general public whenever possible. I thank you all very much.